Looking at the data on workplace clusters, I mean, it's clear in Vancouver Coastal that restaurants are the overwhelming driver. But if that's just looking at staff, since it's workplace clusters, how much of that risk is reflected among patrons too? As in, can you explain how this data drove your decision to close indoor dining? Was it as much for staff as it was for customers themselves eating at the restaurant?
Yeah, it was a little bit of both, and that's the more qualitative part of the data that's not reflected in numbers. So the investigations that people were doing, and a lot of that is, restaurants, bars, pubs in Vancouver, but also in Whistler and in the Vancouver coastal area. Also a large part in Fraser Health. So it was a combinations of things, and consultation with the restaurant associations. People were following COVID safety plans and were adhering to them, and they were working. But now we started to see a lot more of interactions where people were pushing the limits and not wanting to do what people asked them to do. And we saw that in certain communities, and in those places we saw a lot of transmission both between staff and patrons and between staff and their households. So the social connections that people have spilling over into workplaces, spilling over into people who were in those workplaces in the restaurant sector and pubs and bars. And, it is unfortunate, and I hear from people who work in those industries, people were doing their best, and in some cases it became very challenging. And yes, staff people were becoming ill, and people were pushing the limits, not wanting to limit it to 6 people to a table, wanting to get together and congregate at the end of the night. So and with the introduction of more transmissible viruses that were causing infections, suddenly those of leeway that we had were no longer able to protect people, and we saw lots of infections in some related to some of those networks in the indoor settings. So yes, that was one of the main reasons why we stopped those settings, to move them outdoors. Same thing with gyms and fitness centers. Things that had been working quite well in many places were being taken advantage of in some places, but we started to see across the board increased transmission from some of the group activities that were happening in those settings.